This conference will now be recorded.
Yeah. Good morning, everyone, and welcome to today's Humpday Huddle. My name is Shania Chambliss, and of course, I serve as the Regional Sales Director for Empower Brokerage over the Georgia market. I am really excited about this Humpday Huddle because this is one of my first ones being off the road. So, if you recall, we Empower was a sponsor to the Medicarians conference, which I really hope that in within the next year that more agents, especially from Georgia, can participate in. It is a conference that is in Las Vegas. But it was just great to be able to connect with carrier partners, with just other industry leaders that are within this space. So it wasn't just for Medicare. A lot of the topics that we were talking about during Medicarians was also life and annuities. ACA was a huge topic, and all of the changes that are going on within CMS. So I thought it was very fitting before we kickstart our next few weeks of specific product trainings to do a mid-year reset and have a mid-year reset with you all and talk about some ways we can 10x your next 90 days prior to AEP. This is probably outside of the AEP season, this is probably the most important time of the year. These next 3 months are really going to be what sets you up for a successful AEP. So, we're going to talk about some ways to make sure we're 10xing our next 90 days. So, today we're focused on building momentum, a pipeline, and predictable production for AEP. And we do that before. I always tell people, before October 1st hits, you should have a full calendar for the month of October and half of November. And how do you do that? You start building your pipeline now and make sure you have the momentum needed to be able to get through. So let's do a reality check, right? You all spend so much time on these trainings in Empower University, talking to the carrier partners. I know it's a lot, but ask yourself realistically, how many apps have you submitted this month? Okay. How many meaningful conversations have you had this week? Whether it's you introducing yourself to other agents if you're interested in recruiting, or you're talking, posting on social media about the things that are going on within the industry. When you hear, even from this call, I am hoping that you can turn at least something I've said within this Hump Day Huddle and turn it into a social media post, turn it into a newsletter for your current clients or any leads that you currently have. And are you building a pipeline or are you just surviving? Again, this is not to make you feel bad or anything, but it's really just to bring just to have a reality check so that you can be intentional about the next steps that is ahead of you. So the 10x production blueprint, you should be having 5 new conversations daily. How do you have these new conversations? In multiple ways. I have some agents that are saying, Shania, I can't really leave the house. I need to be able to, do this online virtually, whether it's calling leads, whether it's posting on social media. So just make sure you're having 5 new conversations daily. If you are like me, it's warm, the people are out, make sure you are out and about, showing up to different senior centers or different doctors' offices. But you need to be having 5 new conversations daily. Also, 3 follow-ups daily. Your follow-ups are more important, honestly, than the conversations. A lot of agents, they will call the leads, they will, go to an event, they will get a request form for you to be able to reach out to the client, but a lot of agents don't follow up. So make sure your follow-up game is super strong and that you are making sure you're following up on these calls. 2 quotes daily. The only way you're going to be able to know the product is to be able to get from the conversation piece to the actual application piece. So make sure you're actually going into the different carrier portals, understanding how the plans work, understanding how the applications and the quotes work so that you can be a more efficient and more effective producer or agent. Then also one cross sell opportunity daily. So most of us, you've already sold that first policy. And unless you stacked on everything you could give them initially, which would be great, you have an opportunity to cross sell. So make sure you are utilizing those opportunities and reaching out to clients on a daily basis to let them know what your recommendations are. And then lastly, your provider and community relationships weekly. Connect with one new person weekly. That's something that I've been working on. I too am, as the sales director, I have goals. So I have to make sure that I am able to bring you all more opportunities, more relationships. So make sure you are putting yourself in a position. If you go to church, reach out to a new church that's in your area. If you see a church that is doing, especially like a food drive or they have a food pantry, those are the types of organizations and community relationships that you want. So the mindset shift. So this again is the mid-year reset, right? So we have to make sure we are shifting our mindset. So more momentum, less motivation. The first half of the year is all about being motivated. I can do this. Let's train, let's train, let's train. Now it's time to really put the actions into play. So let's build momentum. How do we build momentum? Is by doing things every single day, doing things that are going to generate revenue. So you want to make sure that you're doing at least 3 things on a daily basis that's going to generate you revenue. That's quoting, that's starting new conversations, that's reaching out to one new relationship. But make sure it's momentum over motivation. You do not need a new season to grow. You need a new system. Come up with your system of what it looks like. Go ahead and envision AEP. Envision your schedule. Envision how many appointments do. First of all, you want to do look at it from a bird's eye view. What would make you feel like you had a successful AEP? How many lives do you want to impact? How many families do you want to help? When you get it down to the numbers, you're able to track it and you're able to make sure you're in the position to really attain that goal. So just make sure we are utilizing that and creating that as a new system. So provider partnerships, that is a hidden gold mine. So in the next couple of weeks, we will be hearing from CenterWell, Senior Primary Care, Village Medical, Kaiser Permanente. We'll also hear from some other opportunities as well. But these are the times where you need to go introduce yourself to primary care offices, pharmacies, be a part of different community screenings that are going on. Agent of the day opportunities. Stop chasing leads only and start building ecosystems. How do we do that? By building real relationships. Going into whatever, a PCP office, a pharmacy, and leveraging you as a partner. I want to help you with whatever that goal is. If it's helping them to generate more United Healthcare clients in their office, then that's something that you can do as an independent agent. So how do we do that? CenterWell Senior Primary Care, again, they will be one of our guest speakers on Humpday Huddle, not next week, because next week is AFLAC, but I think it'll be the week following, but I will send out information regarding that and a calendar invite. But so we have a contact, Shiniere Norman. But for PCP offices, these are going to be where you just kind of walk in, introduce yourself to the office manager, maybe take some cookies with you, stop by Fresh Market or Publix, and just say, hey, my name is Shania. I am an independent agent in this area, and I would love to partner with you and assist your patients. with their insurance coverage. Even get deeper and ask them. You could talk to the biller and ask them which insurance company reimbursed them the most. That is going to do very good for that biller because a lot of times they get paid on a percentage basis on how much revenue they're able to get back from the insurance companies. So you talk to them, you say, hey, well, I actually have a contract with United Healthcare or Aetna or whatever, Devoted Health, and let them know, of course, we're going to do what's in the best interest of the client. But if I do see that Devoted or United Healthcare is a better fit for the client, I would prefer to put them on that plan. And that in turn helps that primary care office. Agents, they do it all of the time. But again, just make sure you're starting to build an ecosystem and build trust with those providers. Cross-selling, that's actually makes sense with this because you want to make sure that you're able to offer dental, vision, hearing, hospital indemnity, cancer plans, life insurance. When it comes to Medicare, ACA, you always want to offer your supplemental and accident plans, and of course, life insurance. You want to protect the whole household, and that's what sets you apart as an independent broker. I'm also going to mention here as well, I don't think agents really take advantage of this whole ecosystem here. So for Medicare, we have one plan, dental and vision. And only time you would really add a dental and vision plan is for Medicare supplements. But hear me on this. With what's going on, the landscape of Medicare Advantage, we're seeing a decrease in the plan benefits, right? So we see that plans are only offering $1,000 towards dental, and it may not include dentures, etc. Well, if the client budget allows, and honestly, if they need dental work done, it would behoove the client to go ahead and have that dental and vision plan added to that Medicare Advantage plan. So when you are asking or you're going through your fact finder, you want to be very intentional about every single question that you are asking. Okay. And then also your hospital indemnity. You should be mentioning that on every call. You would not be surprised how many agents I talked to in Vegas that were not offering hospital indemnities. They were doing hundreds of Medicare Advantage, but they offered not one hospital indemnity. And that I know for a fact, and we're bringing on some of those agencies, that it would be a great opportunity for them to go back and rewrite that book. Dwayne Long, one of our old sales leaders here at Empower, he used to do a presentation when I first joined Empower. It was about cross-selling. And he literally showed how by not asking the questions regarding that will lead to a hospital indemnity, agents are leaving on average $50,000 a year by not positioning the hospital indemnity plan. So make sure you're in the position for that. Also, cancer and life insurance. Same with ACA. Make sure you are just offering a package solution at the end of each sale. So some Medicare updates. We know a lot is happening, right? So clients are more concerned about their out-of-pockets. Maximum out-of-pockets are increasing. Their cost sharing is increasing. We're starting to see a trend in plans that have a medical deductible. So I'm very interested as this 2027 plan, as the 2027 plan year gets closer, to see how the carriers are going to position themselves and really develop their plans. We should be, when we are looking at health, right? I know a lot of agents started on the life side of things, but in a moment, I'm going to pull up a plan just really briefly. I need for you all to really be intentional and just learning the plans. When you hear, for instance, during within the next few weeks, we'll be hearing from the carriers. We'll be, being invited to the different carrier events. You want to hear specifically what the key plans they are positioning, and you want to at least go in and start to see what plans are going to offer more dental, what plans are offering more vision, what those hospital part, so what the hospitalization copays look like. If there are any medical deductibles, you want to get in the habit of really starting to memorize that. And even if you can't memorize it, put it in a spreadsheet so that you can really help position your clients in the way that you should. I was having a meeting with one of our amazing agents last week, and we were talking about it was a specific plan for dual eligible. And one of those things that I want to tell you is that, I'm sorry, I was just looking to see if we had any notes in the chat. Sometimes broker managers, as good as what they do for the brokers and for the community, a lot of them have operational backgrounds. They work with carriers on the operations side, but not many of them have the real in the field um, type of training that you and I have that know how these plans work. So one of the things that came up was the QMB and clients that are dual eligible, DSNP, right? And so she had a client who was QMB, meaning qualified Medicare beneficiary. That means that all of the cost sharing is being taken care of by Medicaid. Okay. That's going to be your any copay to a doctor's office, to a hospital, an ambulance ride. That means Medicaid is going to cover everything. And if that's the case, that means that the client will not and should not pull out a dime to offer the doctor. I'm telling you because I want you to make sure you're educating your clients, letting them know if you come across someone that is QMB, let them know to never pull out any type of copay because it is actually illegal, and let them know they should not have any cost sharing. But I also want for you all to know that there are differences in the dual eligible landscape. You have FBDE, which is full benefit. I'm sorry, FD, full dual beneficiary eligible. I'm sorry. Let me. I'm saying that wrong. FDBE, which is full dual beneficiary eligible. Yes. So
Hey,
you
how you
have
doing?
QMB plus. You have QMB. You have SLMB. So we're not going to get into all of those levels right now, but I want you to know that they are different levels of Medicaid. And just because you find out a client has Medicaid does not mean that you're able to put them on
Zero.
any type of plan. So just be very intentional with that. We'll go over that within the next few weeks. If you have a specific question regarding those
All right,
levels,
thank you
you
so
can
much.
reach out to me and we can go over those specifically. Next, I want to also remind you that ancillary products are becoming more important. We just talked about that. Members, they need an actual plan review, not just an AEP conversation. Oh my goodness. Another big conversation that came up during Medicarians is the rise of AI, right? We're using AI for everything, for flyers, for follow-ups, for customer service. We are seeing such a trend in the shift of technology and moving from human interaction to artificial intelligence. We've all called a business line and have been answered by an AI bot that's able to navigate the phone systems. We're now using Claude AI to build websites and to build different systems to help with customer interactions. However, the main thing that was taught during Medicarians is that clients need real people. An AI bot cannot feel the emotions of what a client is going through, go through the necessary steps, apply them for Medicaid, apply them for low income subsidy. A AI bot does not have empathy. So that means that really you may see, different campaigns or different companies coming out with different AI technologies, but that does not remove the need for you. It is a time where you have to literally go through everything with your clients, go through that fact finder. Even if these initial calls take 45 minutes, sometimes an enrollment may take an hour. You have to spend the time with these clients. That's what's going to, number one, build your ecosystem. It's not just, I remember when I worked at a call center, that was my first introduction into the insurance space. We had to keep a call under, I think it was, they wanted it under 15 minutes. And that would leave a lot of quality issues. So we had quality control. And part of quality control is you had to make sure you were saying everything in a compliant way. And so that's why you joining these calls are very important so you can really stay up to date on the industry news, on the things that are changing within compliance. But I'm saying this to say you really need to make sure you are providing them with an annual plan review, and just make sure you're going through everything with your client. Next, position yourself as a solution. Again, we talked about reviewing the dental and vision coverage, hospital indemnity plans, cancer and critical illness protection, prescription drug costs, which is a huge opportunity, and final expense/life insurance. Now, I'm going to tell you with AI, what I would use AI for is I would use this as an opportunity to position yourself and create your system. So I use Otter AI, which would actually be very good for you all. Is you can utilize this as a transcription service. So of course, all calls have to be recorded. So use Otter AI at the beginning of every single call that you're having with your client. That way you can copy and paste that transcription and put that in your CRM. CRM that I am going to just recommend right now is Less Annoying CRM. I like it. I also like Zoho. My preference is Zoho. That's what I started off using. And I like it because it is buildable. Less Annoying CRM is literally a CRM that is pre-built for a health and life insurance agent or agency. You can you can go in as the agent mode, or you can create a agency profile where you can track commissions, downline agents, those types of things. So just make a note of that, and research those. Of course, I just want to remind you that you do have an opportunity today to start conversations. So you should not just wait until September or October to start having conversations. Go ahead and make your AEP post now. Say, hey, AEP is coming up. Let's start having a conversation. Go ahead and get those clients on the books right now. Talk to them today. Do a fact finder today. The more fact finders that you're able to do today means the more sales you're able to close during AEP. So you need to make sure you're being very intentional, and having those conversations. So let's say you have a client that you do a fact finder on today, and you realize, hey, there is nothing I can do for them today. Well, guess what? Well, this is your very first client that you're going to enroll for AEP. Go ahead and put them on a follow-ups calendar. We know, just like doctors do, get in the habit of creating an ongoing calendar and following up. It may take 2 to 3 follow-ups, but at that third follow-up, you can close that sale, whether it's Medicare. At each follow-up, I would actually mention a new product. Say, hey, I was reviewing your Medicare Advantage, and I know you mentioned today that you need some dental work done. So I do want to go ahead and also recommend that dental plan. I also, and that's going to give you, bring you to $50 a month, because we know most of the time clients are not paying for their Medicare Part C plans. You can then position the cancer plan. October is coming up, and I am a huge advocate for cancer awareness. October's coming up. Let's position some cancer plans, right? Let's say, hey, with every, just tell them, you have to be, intentional about your marketing. But I just want to mention that. PCP provider partnerships. We talked about the importance of that and re-engaging your existing clients before AEP. AHIP will release for 2027 on June 22nd. So if you are a newer agent, you have not taken the AHIP last year, I would not recommend you taking it until after this plan year 2027 is out. Closer to June the 22nd, I would say either the week of or the week after that, we will be going through the AHIP. I make it a point to get my AHIP done early every year because we know that during the AHIP, things do still change after the AHIP is released. We see that CMS comes in and they may overrule something or have a final ruling on something that's been delayed. So get your AHIP done early so you can really be in a position to flourish. Here's just a mid-year Medicare script that I've come up for you all just to kind of help. It just says, hi, I'm doing a complimentary mid-year Medicare check-in to make sure your current coverage is still meeting your needs and identify any potential gaps before AEP. Have you had any changes with medications, doctors, or health concerns this year? I mean, it's very simple. It could either lead to a cross-sell opportunity, but the overall goal is to protect the entire household, not just the policy. That's also a great time for you to ask about any family members or any referrals. Life insurance. Life insurance updates. We want to make sure that the conversation has changed and families are seeking income protections. Let me tell you, I saw the saddest thing. I saw that it was a family in Louisiana. It was just tragic. Like, I think 8 children were killed. And, my first thought was, I just couldn't imagine what that mother was going through. But I also thought, if they had life insurance. And unfortunately, they didn't. But even though that some clients are not able to afford, we really are very blessed. I know everyone on this call, we are so blessed because we have the opportunity to have an uncapped income. Most of us, I would say most of us on this call are living better than the other 80% of the country, right? Because there are people that are really going through extreme poverty. And so we are in a position to really help educate them. Number one, through either a licensing class, right, to even get the information to help position themselves for greater. But number two, we have plans like an accidental plan that costs maybe $10 to $15 per month that you can offer, and maybe even cheaper for children. But that you can offer instead of having a plan, or let's say it may be $50 a month for a family of 5. But you also have an opportunity for a term life insurance policy. Let's say you put someone on a 25,000 term life insurance policy, right? For 10 years. And I'm just saying this because there are some people that cannot afford it. So you put someone on a 25,000 term life for 10 years, and then you add children term riders to that policy. You now have given the entire family some coverage that will help in the event of something, even if it's for pennies on the dollar. These are the opportunities that you have. And so it doesn't matter what situation someone's going through, you have an opportunity for them. Some of the carriers you can position for this would be National Life Group with living benefits, Foresters, you get a free will and scholarship benefits. So that would be my go-to if someone has a child. Gerber which is going to be the guaranteed issue plan and the grow up plan. So guaranteed issue is going to be for anyone that is, taking a lot of medications, that may have some pre-existing conditions. It's better to have something than nothing. Also, Ethos, that's not on this presentation, but that Ethos contract is now live in Sure LC. So you want to make sure you are making the most of that. Transamerica has broad product options. So simple questions to ask. If something happened tomorrow, would your family be financially okay? Okay. Cross-sell opportunity with the life. We already know, who we can position that to. Medicare clients, ACA households, grandparents and parents, small business owners, and caregivers. A great question to ask business owners is if something was to happen to you today, would this business be able to survive? If you are setting up a true business, right? I took a Goldman Sachs Business Accelerator, and I'm going to recommend this for each and every one of you. It's called 1 Million Black Women. It is a free cohort that Goldman Sachs has set up for women of color. And they fly you out to New York City to the Goldman Sachs headquarters. They give you a $2,000 stipend. They have a pitch contest for you to be able to pitch your business and get real funding. And they also have it's a business accelerator. So they pair you up with a business coach. I mean, it really was a life-changing experience for me because they're giving you an MBA within 10 weeks. They have a professor from, oh my gosh, Melissa, she is from I can't even remember the university, but it's an Ivy League school. And so I would recommend every one of you to look up 1 Million Black Women. Goldman Sachs, they dedicated $100 million to pouring back into Black owned businesses for women. So I just wanted to mention that for you all because I really would recommend you looking into it. You do have to apply, and they do have different windows when they are um, accepting applications, but I think it's something that would really help you all because it helped me. Next is going to be fast cash flow strategy. So review your current book and ask, has income changed? New grandkids, mortgage, health changes, retirement concerns. A way you can do that is by utilizing Zoho. So what I like to do is I will create a Zoho campaign. In my Zoho campaign, I will go in, I will come up with, let's see, has income changed? We can utilize AI, chat GPT, come up with a social media post for me regarding income changes to help me cross-sell life insurance. Turn that into a newsletter that I can send out to my client book of business. Then now chat GPT has just automated all of this for you. So just be very intentional about utilizing these cross-selling opportunities. ACA update mid-year opportunities still exist. We know a lot of changes are happening with ACA. Some of those changes, Cigna just announced that they are pulling out of the ACA space altogether. So that means every single person that has a Cigna plan will have to be rewritten, right? That's a huge opportunity. Last year, Aetna ACA was a huge opportunity. That means there are millions of people that are going to be without coverage next year. So I would go ahead and start positioning that. That's going to be some of the social media content I would recommend you putting out today. They're starting to receive letters and they're like, oh my goodness, what am I going to do? So be very intentional. Our Georgia ACA carrier positioning, of course, Alliant Health Plans. This is a new contract for Empower Brokerage. Alliant, of course, has been around for a long time, but this is a huge opportunity. If you ever come across a client, all right, for ACA that does not have an agent, you can call Georgia Access with the client on the line and add them to your book of business. Okay? It's called an agent of record change. That's an opportunity. All right. And start receiving commissions within the next month. Let's see, loss of coverage, job changes, your income changes, family size changes. These are just different changes that you're able to see that creates opportunity to still sell ACA. I'm going to go back to Medicare really quickly. I just want, I'll mention it. Also for Medicare, Clear Spring Health is now pulling out of the Medicare space altogether. So that's also a huge opportunity for Medicare going into 2027. ACA cross-sell strategy. So don't stop at just health insurance. Cross-sell stack, make sure you're stacking them. So with ACA, you'll have dental, accident, critical illness insurance, life insurance. Questions to ask. Has anything changed with your job, income, or household? If you had an unexpected illness or accident tomorrow, would you be financially prepared? And that's something I want you to ask yourself as agents, right? We want to make sure we're positioning ourselves for that as well. Protect the goal, protect the whole family, not just the health plan. Aflac and ancillary positioning. So, of course, we have this new partnership with Aflac. Next week, I want you to be on time. We have Griselda with Aflac, who will be doing our first initial training as a team here in Georgia. We want to show up. We want to ask questions. We want to be engaged because this is a huge opportunity to really learn about the Aflac culture and how you can position this product. If you have any agents that are in your downline, also go ahead and let them know. I should have sent everyone on this call a invite to our training next week. If you do not have that, send me an email and I will make sure you get on that list. Also, you can forward that invite to your downlines as well. So make sure you're positioning the products through a need-based conversation, and it helps clients protect income, health, and legacy. So this is just a reminder for the Aflac training next week. This is really to position yourself to utilize Aflac and create real production for yourself. We'll start off, we have started off with contracting at an amazing rate. We were talking to Aflac I was talking to Aflac last week, and they were just saying that they are really impressed on how we have grown within the state of Georgia. So I'm excited about the growth for this opportunity. And this is really going to help increase household protection, create additional revenue streams for you, strengthen retention, and protect clients beyond major medical. So next week, make sure you are a part of that meeting. All right, so fast cash flow before AEP. How to make your next $1,000, right? I would love if you did that, by the end of the week, but give yourself to next week. Requote old leads. I know I was working with Tanya and Teams Essential, and we were doing a life insurance quote for a client. We're going to follow up with them. That'll be one of your following up visits that we'll do. So let's get on that. If you have someone that you want me to work with for you, just let me know. What I'm going to talk about some things that we're doing to streamline, especially our licensing class as that grows. So I'm excited about that. But we're going to be coming up with a system, really just you booking a RSD call. And I'm going to open up my availability for RSD calls as AEP opens. I tell agents this, people ask me, oh, I don't know your business hours. There are going to be 3 main ways to get in contact with me. Number 1, if it has to do with anything Empower related. So anything Empower related, like a contract, a question to a product specialist, ACA team, always copy me in those emails because a lot of times it may be something that I can do to help push those things forward. I mentioned as well, Kathy is out right now. So she will not be responsive. So I think it's make sure you're always copying me in those emails. If it is something that is sales related, then we can start a conversation via text or email. You can just go ahead and book a RSD call, which would be even better because we can have a set aside time that we can go through your specific need. But I also want to mention, send me a text. I will be better with responding to text. I do have two phone numbers. So if everyone would just take down this phone number, my phone number is 817-410-5894. That's my Empower hotline. And then I also have my cell, which is 478-476-7471. My text line is always open. You never have to think, oh, I can't reach out to Shania at 12 o'clock at night, because I'm this type of person. I love what I do. I'm always working on something. So I may just be working on something at midnight and I can respond really quickly. But if not, then I'll get back to you, promptly. But I just want you to know that my text line is always open. You're going to see through AEP, there may be nights you may be up until 11 p.m. putting in policies. I mean, I'm not wishing that on you, but it's just the reality of what it is. And so, especially as AEP comes to an end, what I'm actually going to do, I'm going to create a WhatsApp. We have a Facebook group, but I think WhatsApp would be a little bit better because I think community matters. And as we continue to grow, there may be a question that one agent may have that another agent has already put in the chat and has had an answer to. So we're going to create that WhatsApp. I'm going to put that in an email. I'm going to start that. And so I want you all to start joining that WhatsApp, so that we can make sure we are on the same page. But of course, we want to make sure that we're requoting old leads, revisit declined clients, cross-sell current clients, referrals, and community outreach. Then our 90-day reset challenge. In the next 90 days, let's commit to 25 conversations, 10 quotes, 5 applications, 2 provider relationships, and 1 social media post. Okay. In our closing challenge today, it will be, the agents who dominate AEP, they start preparing now. And what will your next 90 days look like? So I want for you to, ponder on both of those, start writing out a plan. I love the vision season. Now, I am a visionary. I would say God has given me the ability to sit and ponder about what I want and be able to create a plan to get to where you want to be. There are, you write the vision, you make it plain. You have to, in order to get what you truly want out of this. But if you write the vision, after you write the vision, you have to implement. So I would say you have to, within the next month, you should be writing that vision. The next season is implementation. It's summertime. What are you going to do with the summer? The kids are going to be out of school. What outreach opportunity are you able to utilize to serve the community, and in turn utilize that as a way to generate more leads for your business? Everyone on this call, I do urge you to get connected to a back to school drive. Back to school drives are searching for vendors. They're always going to be searching for people to show their get out and show visibility. So between, now I would encourage you to create marketing, even if it's just a flyer, even if it's something that you can go to Staples or Office Depot and print out some flyers, or order on Vistaprint, however you want to do it. But go ahead and start doing that now so you can position yourself. I talked about this on one of my calls with the agent last week, but even myself, we have to be out in the community on a monthly basis. So we are going to, I'm going to be working with each and every one of you. I want you to reach out to me, book a RSD call. Let's get out in the community. Let's let the people know what we're doing. Now is implementation time. So, in whatever way I can help you, I am here to help. So now I'm just going to open the floor up for questions and we will be wrapping up.
Yeah, I had a question, Shania. I wanted you to elaborate more on the agent of change.
Okay.
So, like
So, okay.
specifically, how does that work? Thank you.
So, agent of record change is so you come across a client, and when you are writing up an ACA plan, you have to sync to Georgia Access. So Georgia Access is okay. So ACA certifications would be we do our FFM certification, which is our federal facilitated marketplace, and we also do our Georgia Access certification here in the state of Georgia because we have a state exchange. For the federal, anytime you are logging into Health Sherpa, which is going to be your ACA enrollment platform, you are going to have to sync to FFM. Okay, you're going to have to log into portal.cms.gov. You're going to have to sync that so that you can be able to connect to the clients. You're also going to need to pull that client up in Georgia Access. So anytime you're starting your day, a few things that I like to have up already is my Georgia Access portal up, and I need to go in and sync with FFM, with the FFM portal. All right. So anyway, so that's the base of it. But let's say we are connecting with a new client and we find out through Georgia Access Portal that they do not have an agent of record, that they do not have anyone attached to their profile. Then, with the client's permission, you would need to say, hey, I need, would you like for me to be your agent? They say, yes, I would love for you to be my agent. I need the help. I appreciate you for calling me and following up and working hard on this. Then you do a three-way call with Georgia Access and that client. And then you say, hey, Georgia Access, I want to become this client's agent of record. Georgia Access will then, get some information from that client, make sure that they are agreeing to that, and then they will then add them to your book. So you will then now start to see that client show up on your commission statement. I hope that answered your question.
Yes, ma'am. Thank you.
Okay, good stuff. Anyone else? Okay. So before we get off today, I know we are right at time, but I want to talk about the licensing class because I have had, some agents have had some frustrations, and it's not just here in Georgia. I've heard of some other states as well. But this is what we're going to do to streamline it. We are now going to come up with our own system here within Georgia. So Empower, they have their method of having things submitted, but we're going to come up with our methods as well. Because this agent licensing class, it is a great opportunity, but it's only a great opportunity if it works the way it should. So number one, the process is this. You are now going to send me an email. I'm going to be sending out a spreadsheet. When you fill out this spreadsheet, you're going to add your client's, your agent's name, their email address, their phone number. That's then going to come to me, and we'll be able to see real time the clients, I'm sorry, or the agents that are registered for the class. You'll see that in advance. You'll also, after the class, see what steps or where that agent is in getting licensed. Another thing, we will have a monthly meeting with these agent licensing with the people that are registered for the licensing class, because we need to be able to push them forward. So in addition to what you're doing, we're going to have a monthly meeting with these licensing class attendees and registrants. So you send me, another thing is, we within Empower, you have to submit all of the licensing class registrations the Wednesday prior to the class. Anything that happens after Wednesday, that means that they are now going towards the next month's class. So if there is anyone, as the sales leaders, as recruiters, general agents, I need for you to be very intentional to make sure that you have reviewed that spreadsheet or that list before that Wednesday, because after that Wednesday, there is nothing I can do. So I just want to be, I'm going to work hard on, making sure I'm tying up my loose ends. I just want to make sure that you all are doing your part and making sure that you are following up and making sure that everyone that is going to be in that class is in there prior to that Wednesday. Also, I need for you to be following up with them, making sure they have submitted their DocuSigns. Let them know what you're going to receive a DocuSign within the next, I'm going to give myself 48 hours, but I will try to get it, that DocuSign sent out within 24 hours. That's been a process that I've added to my day to day. So make sure you are submitting that information to me. Let that attendee know, hey, you're going to be receiving a DocuSign. After they've received the DocuSign, I will then submit that to Empower, and you will see that updated on the spreadsheet. That's how you will know that's been updated. Once you see that's updated, then you can let the client know you should be receiving some correspondence regarding that licensing class pretty instantaneously. So, Lorna and Lauren, that licensing team, they will go in and they will start to send some correspondence. Let them know to check their spam mail. After that, I will be following up with them. I'll be following up with you all, because I will see who referred them. So on that Wednesday prior, I will send you a list of everyone that is going through the licensing class that you have referred. So you need to be following up with them. You need to be available for them on the day of the licensing class, at least, on that Saturday, saying, hey, we're going, I know you have the licensing class coming up tomorrow. Shania, Lorna, Lauren, these are the people that's going to be available for you. And then, if there's anything that's needed, I will be available via text, especially the morning of the first day of the licensing class. I always make myself available, and I'm checking my emails, checking my texts to see if there's anyone that needs help with getting in the class. But I just wanted to mention that I'm going to be sending out that information. I know there are some things that I need to send out to a few agents on the call, so I'll be working on that. Miss Tanya, I would like if for us to have a RSD call soon. We haven't caught up in a while, so just let me know when you're available for that. And then Miss Lucky, I'll also work on sending you the transcript from our last meeting. So, is there anything else that you need from me?
No, ma'am. Cool beans. This is a great call. Another great call.
Awesome, awesome. All right. Well, this call is recorded. I'll go ahead and send this to you. You can send it out to your team. Just let me know if there's anything else you need.
Thanks, Queen. Have a great day.
You're welcome.
All right.
Hello, and thank you for calling. This is Shay Norman with CenterWell Senior Primary Care, Broker Relationship Manager for the Georgia market. If you need to reach me quickly, please send a text message. Other than that, please leave a voicemail and I will get.
I thought this was.